What normally happens when you go to hospital? A health provider, that is a doctor, nurse, or a clinician like we, will examine your whole body for marks, bruises, and wounds and treat any injuries that will be present at that time. The examination may be uncomfortable and embarrassing, but it's very necessary so that we can see the excessive injuries that might have gotten at that time. No procedure will be done to you without your consent. So, with whatever examination that will have to happen, you'll have to get your consent first. You'll be asked questions about the rep. You need to answer them frankly. The health provider will treat you with dignity and keep your information confidential. All people that go to the hospital have a right to confidentiality. I'm not supposed to spread rumors of you being raped even if I know you. That is very private. Any patient that comes, apart from rep, any patient that comes to hospital, we are supposed to carry those details with a total confidentiality. The health provider will take samples such as blood, urine, vaginal, or anal fluids for laboratory testing, including HIV and pregnancy for women. That is mandatory. You will receive treatment, and the health provider will record all this information in detail in a post-rep care form. There's a form that we normally fill during rep cases. If you do not understand anything, ask the health provider to explain. It is your right to know what he or she is feeling on that form. Kindly ask questions. If you have been to the police, give your P3 form to the health provider to fill. This forms part of the health provider medical report. Okay? When you go to report this to the police, you're given a P3 form which you go with it to the hospital. If you have not reported to the police station, you will be required to do so in order to be issued with the P3 form. Okay? So what treatments do you need if you have been raped? As I said earlier, care of injuries and wounds, treatment to reduce chances of HIV infection and STIs, emergency contraceptives to prevent chances of pregnancy. For example, the emergency pill like Postino 2 can be given to you. Okay? The emergency pills may be beneficial up to 120 hours after rep. If these are not available, your health provider may give you a combination of pills from the normal oral contraceptive pills. Even if you're in the rurals, if there is no Postino 2, they can give you some pills from the normal family planning pills. Counseling for trauma, drug adherence, and psychosocial support, very important. That client, that child, that boy, that man, that woman needs to be counseled no matter what. Even if it's me, I'll have to go through counseling. What you should know about PEP, which refers to post-exposure prophylaxis. This is given to you to prevent you from getting HIV. These are antiretroviral drugs given to reduce the chances of HIV infection. HIV test is necessary to determine whether or not you can take PEP. So normally HIV test is done. If you're already HIV positive, you will continue with your medication. If you're not, you'll be given PEP. PEP will benefit you only if you're HIV negative. If you're positive, it won't. In fact, it will make you get drug resistance. PEP is prescribed and managed by a qualified health provider. Do not stop PEP without consulting your health provider. Actually, you should just finish the dose. Now, what are the lab tests that are normally done? We have a HIV test, vaginal, anal, or oral swabs. This test will check for sperm in these areas and can be used as evidence. However, the absence of sperms does not mean that you are not raped. Noted? A pregnancy test, yes, to confirm whether you're already pregnant or not. If a pregnancy test cannot be done, you should get emergency contraception, as I said earlier. So, What if I was raped and did not take PEP? Does it mean I have HIV? Not necessarily. It is hard to say exactly what the risk, but it is dependent on the number of things. There's a chance that the person who raped you was not infected or was not infectious. Maybe has a low load of HIV virus in his blood, or it doesn't have at all. The risk is less if the person who raped you did not ejaculate. It's less. The risk is less if the person did not ejaculate in you. The risk is higher if there were many people penetrating, that is during a gang rape, and in case there were vaginal or anal tears, there is a likely chance you'll be at risk. So it's important. What if my HIV result is positive? If you test positive of HIV, you'll be referred to HIV care and treatment clinic. Here, you'll be offered with information about HIV infection and related illnesses, treatment to prevent HIV-related illnesses, ARVs to manage the HIV infection for those who are not on ARVs, but for those who are already in it, they will continue with medication. Counseling and psychosocial support include support groups. There are so many support groups in our country nowadays that help such victims. What can I do if 72 hours have already passed without medical attention? Medical evaluation and treatment of any outstanding injuries is very important. You need to do it even if 72 hours have gone. HIV testing, this is important to help determine your HIV status so that you can be given the appropriate referral care and support. Treatment of sexually transmitted infections, very important. Counseling for trauma and psychosocial support and filling of the P3 form, very important. So normally what happens at the police station, you might ask yourself, on reporting the rape, a record will be made on the occurrence book, that is OB, and you'll get an OB number, very important. The police will ask you questions about the rape and cross-examine you in detail. Don't get offended, please. You may be asked questions that are difficult or embarrassing, but you need to answer them frankly. You'll also be asked to record a statement and sign it, okay? Only sign when you are comfortable with what is written on it. After you've written your statement, kindly read it. Things can be changed. Another person can put their handwriting there and change the story.